All right, I think we are almost ready to go. Welcome everyone to the very first webinar with Dr. Clay Forsberg. He is a board-certified plastic surgeon at the Center for Dermatology and Plastic Surgery and Camelback Dermatology, and we are very proud and thankful to welcome you today. This webinar is going to be all about facial rejuvenation, treatments, and plastic surgery procedures that are offered. Dr. Forsberg has a lot to teach you. He's going to show you a lot of his real results, and we are live, so we will be open for question and answer at the end. This webinar is being recorded, so if you miss anything, don't worry. We will send you all the recording, and it'll also be on the website and available for you to forward to any family or friends that you think might benefit from this education. Please stay tuned till the end so we can do our raffle. And with that in mind, I am excited to introduce you to Dr. Forsberg. So as I mentioned, he is a board-certified plastic surgeon, and he is the founder of the plastic surgery division at the Center for Dermatology and Plastic Surgery. He's been voted top doc in both plastic surgery face and plastic surgery body during his first year back in Arizona, so you may have seen that in the media. He's also authored and presented multiple scientific papers in the field of plastic surgery to help advance, the field and support all of his colleagues. He's won numerous awards, too many for me to get through right now. But the most important thing for you to know is that his areas of expertise include all sorts of plastic surgery. That includes breast, facelifts, nose, body procedures, and all facial aesthetics. So we are very grateful to have him as part of the team, and I'm excited for you all to get to meet him and get to know him a little bit better now. So, Dr. Forsberg, the floor is yours.
Perfect. Thank you so much, Risa. Good to have everybody with us. Thank you all so much for logging in and joining us tonight. We used to do pretty regular live educational seminars in the pre-COVID days, but this is our first online webinar, as Risa mentioned. So we're excited to try this out and let you all join in and watch from the comfort of your own homes, or maybe tune in later. But Risa told you a little bit about my credentials. I'm also one of those rare Arizona natives. I was born here in North Scottsdale, or I was born here in Arizona. I live in North Scottsdale with my wife and 2 kids. I grew up in the Ahwatukee area, and then I later did my undergrad in bioengineering at Arizona State. And that was before I headed out east for all my medical training. I went to med school in Rochester, New York, and then I did my plastic surgery training in North Carolina. After finishing my training, I spent a few years in practice with this guy, Joris Bunkus, who's a Harvard-trained plastic surgeon focusing on aesthetic surgery in Newport Beach, California. I learned a ton working with him in Orange County, but eventually realized that Arizona was sort of home for me and where I belonged. And so when I had the opportunity to team up with Dr. McCracken and Dr. Petlin and bring plastic surgery into their dermatology group, it was something I couldn't pass up, and I've been loving life out here ever since. As Risa mentioned, one very important thing that I accomplished while in Orange County was becoming board certified in plastic surgery, which means that I have this certificate hanging on my wall back there. We're going to be talking about both surgical and non-surgical means of facial rejuvenation today, and there's lots of great physicians who practice cosmetic dermatology, but if you're thinking about any type of cosmetic procedure, I'd strongly encourage you to make sure whoever you're thinking about doing it is certified by the American Board of Plastic Surgery. So this is the only board that's part of the American Board of Medical Specialties. That's the main one that certifies doctors to perform both cosmetic and reconstructive surgeries throughout the whole body. I think more and more people understand the importance of finding a board certified doctor, but unfortunately now there's these many quote unquote boards out there creating a lot of confusion, particularly some of the different cosmetic surgery boards who give certificates out to people who have little proof of training in their so-called field. Sometimes they can even just take an online exam or a weekend course, pay a fee, and get a very similar looking certification to hang on their wall. But in order to be certified by the American Board of Plastic Surgery, I had to do a 6-year US accredited residency in plastic surgery. I had to take a written exam and have all my cases my first year in practice reviewed by the board to make sure I was safe and competent, and then pass a 3-day-long oral exam that's held once a year. So much different level of stringency than a weekend course. So regardless of where you go, make sure you look for surgeons certified by the American Board of Plastic Surgery if you're thinking about cosmetic surgery. All right, so let's move on to the program of what we're doing in plastic surgery to help people look and feel younger and healthier. Thanks to modern medicine, people are living longer. We're much more active and productive as we age, and so it only makes sense that we want to look as good as we're feeling during that process. That doesn't mean we can make 70-year-olds look 20 again, but if we can give advice to people to slow down the signs of aging and do safe, reliable procedures to help them reverse some of the signs of aging, there's no reason in my mind we shouldn't help people lead happier and more confident, more productive lives. So let's start by trying to understand what we know about the aging process and what contributes to it. These are some of the most common things that affect how quickly we show the signs of aging. Of course, some things like sun exposure, cigarette exposure, which do have an incredible impact, we can control quite a bit. But other things like genetics and gravity, of course, there's not so much we can do about. So these are the way that aging actually shows up anatomically in the face. It really boils down to four major types of change. So the first is changes to the skin surface, the fine lines and wrinkles, the sun damage, like the little red and brown spots that start showing up in the skin. The skin stretches out and loses its elasticity, and so it starts to sag. The soft tissues of the face have a fair amount of weight to them, and so gravity impacts them. They descend or fall down. And finally, volume loss is a big part of facial aging. It tends to accumulate everywhere else, unfortunately, as we age, and we all know that, but it does disappear in the face slowly with time. So both volume loss, especially in the cheek area, and the tissue descent towards the jowls leads to this shape change from a more youthful, sort of upside down triangle or pear shape to a more boxy, squarish face as we age. So now that hopefully we know some of the basic ways in which aging manifests itself, shows up in the face, and a little bit about what contributes to it, let's talk about what we can do to actually slow it down and maybe reverse the aging process. The simplest thing that everybody can do is take good care of their skin. I'm not going to go into a lot of detail about all the different types of skincare products out there because that could be a full day lecture just on its own. But these days, there's a tremendous amount of science behind good medical grade skincare products. We know sun protection is a huge component of a good skincare regimen, but additionally, there's ingredients we know will protect our skin from environmental stressors like pollutants and free radicals. There's also medications and vitamins in the products that stimulate the skin to turn over faster, to thicken, all sort of good things to delay or even reverse the signs of aging on the skin surface. It's an example of a woman who did nothing but spend a few months on a quality skincare regimen, and you can see that the skin looks healthier. The red vascular lesions have faded because the skin's thickened. The day-to-day irritation she gets from the environment's less. The wrinkles will start to soften eventually, and the sheen and texture of her skin just looks better with time. So now let's talk about some of the interventions we can do to help people fight off the signs of aging. I'll touch briefly on some of the non-surgical things first. I'm fortunate to have a bunch of great colleagues in our practices who also perform these procedures, including Dr. Astilos and Dr. DeLuca at Camelback, Dr. Macnow and several of the mid-levels at CDPS do a bunch of injectables, Dr. Van Dyke at Van Dyke Aesthetics. But I do some of these too. So Botox is the most common cosmetic treatment worldwide. It works by temporarily reducing the signal between the nerves and muscles. And so lines and wrinkles that are caused by muscle movement can be softened because the muscles that make the wrinkles aren't moving so hard. This diagram shows all the many muscles that control facial movement. Botox is most commonly used from the eyes up because for the most part, we want to stay away from or at least be very cautious when we're using any Botox around the muscles that control animation of the mouth. Obviously, that's a very important normal social function that we don't want to disrupt in any way. So some examples, here we see softening of the horizontal forehead lines, the so-called 11 lines or scowl lines between the eyes are improved here, the crow's feet out on the side of the eyes here. Fillers are another great way we can reverse some of the signs of aging by strategically adding volume back to the face. Here you can see how adding volume to the bottom of a prominent fold next to the nose or the corner of the mouth, much like filling dirt into the bottom of a trench, it makes it appear less deep, less harsh, softer. catches less light, and ultimately is more youthful and more attractive. That's another patient who wanted to refresh and rejuvenate her face a little bit without surgery. She had one syringe of Radiesse, one of the longer lasting fillers, placed in the cheeks to accentuate those cheekbones and help lift and restore a more youthful contour to her mid face. She also had a syringe of Juvederm that was used to soften the nasolabial folds next to the mouth and the marionette lines down on the corners of the mouth. Another view here where you can see the nasolabial folds real well. And this patient, filler was added to the tear troughs, or the grooves that separate the lower eyelid from the cheek. Young people usually have a really smooth transition from lower eyelid into the cheek area, but as we age, that line separating the two becomes more prominent, and filler added to that area can help soften that. I will tell you from experience, it's much easier to inject somebody you're face to face with than somebody standing in front of a mirror. But fortunately, I found Dr. Astalos, and she's agreed to do my next treatment for me, so I'm looking forward to that next month. This patient wanted a little more volume and definition to her cheeks, so we added a couple syringes of Illuma, another one of the long-lasting fillers. It's subtle, but that's what it's supposed to be. She looks like herself, just a little better with a little more roundness to the cheeks. And these are procedures you can do in the office, get an immediate improvement with no real downtime or recovery time. Of course, one of the most common requests is to add volume to the lips. You can see how it can be done, though, subtly without overdoing things and giving people a nice, natural looking, fuller lip. I think people have to remember the people walking around who you know have had way too much filler are not the only ones out there who have had filler. So most of it's done in a way that looks really good. Fat grafting is essentially another type of filler, but your own fat that we obtain from liposuctioning an area is actually the cheapest, most long-lasting, and most natural filling material that we have available. Um, I often perform this with my facelifts in the operating room, but more and more we're doing it on its own as an in-office procedure under local anesthetic. This patient had no facial surgery, no fillers, just fat from her abdomen injected into strategic locations in her face, the same areas that we use the more expensive, more temporary fillers. The great thing about fat transfer procedures is that on average, about 80% of the fat that we transfer becomes essentially a permanent component of the face because those fat cells become a living part of the face. This is really good for people who need a decent amount of volume replacement because it only takes about 5 to 6 syringes of filler to pay for the cost of the fat grafting treatment. And I'll often inject more than 50 times the amount that's in a syringe of filler during a fat transfer procedure. So particularly when you consider the longevity, it can be a very, very cost effective way to revolumize, excuse me, a face that needs a fair amount of volume. There's all kinds of laser technologies out there these days. Laser hair removal, probably everybody's heard of and is aware of. Just to touch on a few of the kind of main ones out there, the sort of bread and butter lasers. There's things like the PDL or YAG that can significantly reduce the appearance of broken little blood vessels or other signs of redness and rosacea in the skin. There's broadband light treatments, also called IPL, intense pulse light, or photofacials. It's one of the most common laser procedures performed by our estheticians. It helps reduce the brown spots that accumulate from sun exposure, as well as red spots and broken capillaries. Overall, sort of evening out the color irregularities from sun damage in the skin. Can be used not only on the face, but the hands and arms, the neck and décolleté. The deeper laser resurfacing treatments are something that we, the physicians, do. It has a more significant downtime, usually something on the order of a week, doing soaks, applying ointment to the face as the skin heals over. There's generally a few weeks to sometimes a few months of faint redness after that, but makeup can be worn during that time to camouflage the residual healing that takes place after the treatment. It does a great job not only sanding down surface color and contour irregularities like fine lines and wrinkles, it also promotes healthier skin by stimulating collagen production. But here we see a lot of softening of those etched in lines and wrinkles, crepey skin around the mouth of this person. Here, improvement of etched in crow's feet lines. These, by the way, are the same lines that Botox injections are going to help prevent from becoming ingrained into the skin. And this slide shows the normal treatment progression through the first week of treatment, starting out bright red and raw, and then slowly fading and healed over, but still slightly pink at about a week out. As you can see, you can really get a lot of rejuvenation though with an in-office laser resurfacing treatment. So it's not nothing to shrug your shoulders at. This patient had both laser resurfacing and volume added to her face with a fat transfer procedure in the office. So the lines around her lips are improved by both. The bags under her eyes were reduced mostly because of the fat that we added to her cheeks, much like we showed you with the use of fillers earlier. But she obviously started out a little worse here, so we added a little more volume. Another example of both fat transfer and laser resurfacing causing a pretty dramatic improvement in appearance with a minimally invasive procedure in the office. ThermiTite is a procedure that we have that's typically performed in the office under local as well. Essentially, this technology uses a tiny probe that emits a radiofrequency heat energy underneath the skin. The heat causes a very controlled burn to the underside of the skin, which causes a deposition of collagen and a bit of shrinkage of the skin. It can be used anywhere in the body, but definitely the lower face and neck is the most common area that we use it with. Essentially, what happens in the office, we numb up the area we're going to treat. A temperature monitor is present on the tip of the probe, and that allows us to monitor the internal temperature. There's a thermal camera on the outside that allows us to keep track of the external temperature and make sure we're applying a nice even distribution of the heat. And all of that helps us maximize the result. So we want to heat up the inside as much as possible to get as much shrinkage and contracture as possible, but not have an area on the surface that gets overheated, causing a burn or a blister. So the technology sets us up for monitoring that very well. As a surgeon, though, I'll be honest with you that this is a procedure that's not going to achieve the same types of improvement as a lower face and neck lift for the average patient. But it is a great option for the patient who doesn't have the degree of laxity yet to justify that kind of surgery, doesn't have the downtime available, maybe the financial means, or just isn't comfortable with the idea of a more invasive procedure. So there are options available for everybody. This is the same patient you saw earlier who, after having success with the laser resurfacing treatment done in the office, decided to try the ThermiTite with a small amount of neck liposuction. You can see a nice contour improvement under the chin and along the jawline. Another patient, for sure a better facelift candidate. She didn't want that big surgery, still achieved a nice improvement that made her happy with the neck lipo and ThermiTite. So ThermiTite does more to address skin shrinkage. There's also a non-surgical way to reduce the volume of fat under the neck. Kybella is an injectable product similar to Botox that causes permanent destruction of fat cells. It goes in just a few minutes, causes an inflammatory kind of reaction that destroys the fat cells. And so because of that inflammation, you initially see a fair amount of swelling after the injections, but slowly the body will resorb those destroyed cells and the fat remnants, and you'll see an improved contour of the neck. Most patients get about 2 to 4 treatments, though, spaced about 6 weeks apart, depending on how much excess they're starting with. A few examples: patients showing a reduction in the fullness under the chin, front view showing a similar improvement. Side view, you can really see why people will call this injectable liposuction. Not to say, though, that there isn't a role for neck liposuction like this patient had in the office under local anesthesia. The big differences between the two is that liposuction gives the surgeon a lot more control over the outcome of the treatment, and it's a one and done procedure versus Kybella that requires you come back in for multiple treatments. There is probably a little bit more downtime with a liposuction procedure in terms of bruising and swelling, but you only have to go through it once, so overall you spend less time in kind of recovery mode. Liposuction is a minimally invasive surgery. We do make small skin incisions underneath the ears and the chin. Single stitch goes in each one of those, so it's a very small incision used. It's only a needle that is used to insert the Kybella. And cost-wise, the cost of liposuction treatment in the office is usually about somewhere between 2 and 3 Kybella treatments. So it's often cheaper for the series than the series of Kybella treatments to just have the liposuction procedure be done once. And certainly in somebody with a fuller neck like this one, liposuction is going to offer a better long-term result, save the patient money and time with one recovery. It's a patient who had neck lipo combined with a chin implant, and you can see that really makes a dramatic improvement in people who have a little bit of a weaker chin. The chin implant can still be done in a relatively simple office procedure under local anesthesia for patients who want to do it this way, so that's advantageous. And this is a patient who only had a chin implant placed, so you can really kind of see what a powerful procedure this is. Really changes the proportion of her entire lower face, strengthens her jawline, makes the neck angle look much sharper without doing anything to the actual neck. Even makes her nose look a little smaller, which is why chin implants are so commonly done with rhinoplasty surgery. All right, so before I go back into the surgical treatment of facial aging, I want to use this picture again to remind us of those four major components of facial aging. At least three of them are shown on this picture, but there's also skin surface irregularities. But skin laxity, tissue descent, volume loss, and hopefully I can show you how I think a properly designed and executed lower face and neck lift can be the best way to address all of these changes in one operation. So this is a woman who in one procedure had all four of those signs of aging improve. She had the loose skin tightened and the droopy falling tissues lifted back up with the lower face and neck lift. She had fat grafting to strategically restore the areas of volume loss. And then laser resurfacing of the skin around her mouth was done to improve the etched in lines and wrinkles in that area. You can see she had a very nice and rather dramatic improvement, but the most important thing to me is that when you look at the after picture, she looks like herself. She looks natural. And I think it's the fact that we conservatively address all four of those anatomical changes with aging at the same time in one operation that provide this more natural, more harmonious result. So she doesn't look artificial or overdone like the celebrity, the friend, the family member that some people imagine when they decide there's no way they'd ever consider having a facelift. Some of these older techniques in facelifting relied only on pulling on the skin. And if you think about it, young people don't have skin that's pulled taut like a drum. It's just not loose. And so you can't expect a philosophy that involves overcorrecting only one of the four major components of facial aging by over tightening the skin to provide a natural reversal of the aging process. So what are the ways that we go about achieving that natural looking facelift? The basic technique of the procedure involves an incision around the ear. Through that, and usually a small one underneath the crease of the chin, we elevate and redrape the skin of the lower face. But we don't pull it tight like many of the older techniques utilize. In fact, the most important part of the operation is tightening and elevating the deeper plane, those droopy soft tissues and muscles underneath the skin that have fallen, the jowls, the droopy cheek, the saggy neck. So I'm going to warn you, anybody who's squeamish might want to look away. Got two videos in the talk. This one's one of them. There is a tiny bit of blood on the edge of an incision from the operating room here, but I think it demonstrates this concept really nicely. You can actually see the suture and the muscle being tightened and the lift of the deep tissues it provides. The skin resting on top elevates as well without creating a tight and unnatural look to the skin. So sutures in these muscles give the face a more youthful shape by elevating what's fallen down, and then we can just redrape the skin. We don't have to try and pull it tight. And that leads to a more natural looking rejuvenation, but also a longer lasting result because the skin stretches out relatively quickly over time. The muscle and soft tissue suspension is much longer lasting, and it's sort of the foundation that the skin rests upon. So overall, the result lasts a lot longer and looks very natural when we do it that way. The other thing pulling too hard on the skin can do is contribute to poor scar formation, like in this patient who we did not operate on. Definitely, obviously, something we want to avoid. This is how the standard textbook facelift incision is designed, but you can see if you pull up on the upper cheek here, the natural sideburn is going to end up getting removed and an unnatural operated on appearance results. This is how I generally do my facelift incisions. Attention to detail really helps avoid some of the telltale signs that people have had a facelift. We don't mess with the sideburn area at all usually. If I do need to get out into this upper lateral cheek area to suspend the skin there, we'll wrap the skin around the front of the sideburn right in the hairline so the sideburn doesn't change position. We take the incision back inside of the ear, inside of this bump called the tragus. Some surgeons will just make a straight line cut right in front of the ear, which tends to leave a much more obvious scar. We make a nice curved incision right along the natural junction between the ear and the face and go back inside the ear where the scar can sometimes show, so that the incision is very hard to see in most cases once it's fully healed. This is an example of the patient we saw earlier, about 6 months after healing. You really can't see any scarring in front of her ear. Behind the ear, there's a little bit of a scar going back into the hairline, but there aren't the telltale signs that an operation has happened. The scar itself is hard to see from more than a foot or two away, and if the hair isn't pulled up, it's essentially invisible. Now compared to some photos I pulled off the internet with some of the problems that scares everybody away from facelift operations. So again, my patient's on the lower right, the Google search is on the upper left. The sideburn in our technique isn't amputated. The female sideburn is something nobody really notices until it's gone, but then it definitely looks awry. There isn't a big step off in the posterior hairline from moving neck skin that doesn't have any hair on it to where hair should be. There are no obvious visible scars, like a thickened hypertrophic scar from pulling things too tight. And the earlobe isn't pulled down towards the chin due to excess tension being put on the earlobe. So these are all things you see out there and reasons to go to a board certified plastic surgeon. So again, back to our patient, we've provided her with a really dramatic yet natural rejuvenation and kept the evidence of what was done really well hidden. Fat grafting, I already mentioned, it's the best type of filler material that we have available and something I do with almost every face and neck lift in the operating room. It contributes to my goal of conservatively improving all the major anatomical contributors of the aging process, helps provide a balanced and natural appearance to the face as we work on it. Again, the diagram showing volume losses as we age. I think I beat that into you guys by now. But here's some examples. So this lady had a face and neck lift with fat transfer. She had her upper eyelids rejuvenated, as well as a chin implant and a chemical peel to kind of freshen up the skin surface a little bit. The combination of the reduction in neck skin and fat and the chin implant really give her a nice defined jawline. It's another lady who had very similar procedures: face and neck lift with fat transfer, upper eyelid surgery, and the chin implant placed. Another angle. It's not like everybody needs a chin implant, but you can see how the implant, when the chin's a little deficient, can really help improve the dimension of the lower face and enhance the sharpness of that angle between the lower face and neck. This is a 72-year-old guy who had a face and neck lift with fat grafting. You can see those bands on the front of his neck are virtually gone. Some of the hollowed areas in his face are softened with the fat injections. The jawline is smoother, more youthful. There's no noticeable scarring or giveaway that the operations happened. Overall, he looks just like himself, just a freshened up version. This lady had a facelift with fat grafting and lower eyelid surgery to improve the bulging fat pockets in the lower eyelids. She has a neck and jawline again, and even with her short hair, no signs of the incision used to perform the operation. Another lady who did a face and neck lift, brow lift, both upper and lower eyelids, fat grafting, and chemical peel. So kind of the whole shebang. Just 2 months out in these pictures. So big transformation. This is how she was looking about a week after surgery. Obviously still showing some of the bruises on her cheeks, even going down into her chest. Definitely a little rough around the edges still, but for a week out overall, not too bad. Many people, though, these days are interested in starting younger and taking smaller steps to address the signs of aging. They can't afford to have the 2 to 3 weeks of downtime and want to do something simpler and easier. Compared to the traditional facelift diagrammed on the top, the mini facelift basically just makes the incision on the front side of the ear. It doesn't wrap around the back. And so that allows us to make a significant improvement of the lower face and jowl area, but not so much on the neck. But the scar is shorter, the amount of undermining is less, which means a lot less bruising and swelling. We still place those deep plain tissue lifting sutures shown in the video to maximize the longevity of the result. in the right patient, this can be a great alternative that gets people back to work quicker, usually in about a week, and it's less of a big deal to go through because it's performed in the office with a little local anesthesia and maybe a few Valium to take the edge off for the 2 hours or so it takes us to do the work. Here's a patient with a mini lift 4 months out. Also had some laser resurfacing around her mouth. You can see the facelift improved the skin laxity of the lower face, while the laser improves the wrinkles around the mouth and helps to even out the skin color and improve the tone and texture of her skin. And from the side view, subtle, natural, but still a significant improvement in the jowling and laxity that she had lateral to the mouth. This is a patient who's only about 2 weeks out from a mini lift with some neck liposuction in this picture. She does still have some swelling, but you can see the improvement in the neck contour and softening of the jowls with elevation of the cheeks. Um, Another view showing the significant improvement in her jawline. Another patient, mini facelift and some eyelid rejuvenation, again, both done in the office. Really nice and natural improvement of the jawline and the folds next to the mouth. Being critical here, if this patient had valued a more complete improvement of the neck over the simpler procedure with a quicker recovery, we could have taken her to the operating room and extended the incision back behind the ear to more completely get into the neck and tighten that area up. Sometimes, especially my male patients, the neck is the area of major concern, and again, patient wants a simple in-office procedure that can make a nice improvement on the neck. This patient had what we call a direct neck lift. That means we directly excise all the redundant turkey gobbler skin on the front of the neck. The major disadvantage here is the visible scar that's left on the front of the neck. But really, in most patients, this does quite well, especially in a more natural kind of conversational position rather than extending the neck back to tighten it and show off the scar like the photo before. Sutures for this one come out in about a week. Usually bruising and swelling is quite tolerable about a week or two after the surgery, and the scar fades substantially over the first few months. Um, our most common office procedure by far is upper eyelid surgery. It's done quickly and easily under local only. Patients are usually in and out of the building in less than an hour with about 30 minutes of actual procedure time. It has a very low complication rate, incredibly high patient satisfaction rate. Essentially what we do is remove this pinch of skin from the upper eyelid to improve the hooding and fullness of the upper eyelid. There's a suture line that stays in place for about a week, which is about how long it takes to recover from the procedure for most people. The final scar quickly becomes almost invisible right inside the natural eyelid crease at the level of the lower incision that was made. You can see the amount of skin hanging down, kind of touching the eyelashes, is reduced significantly. There's a lot more show of the eyelid itself. And the lashes, while they've been augmented here, are allowed to turn up more. Overall, contributes to a more rested, more youthful look. Very subtle, but patients love this procedure. Another example of a similar result. Here's a male patient with nice improvement of the heavy, excessive lid skin. This is the only one in the bunch that chose not to augment his eyelashes after the surgery. Lower eyelid surgery tends to involve the deeper fat compartment that cushions the eyeball inside the eye socket. This is what causes the appearance of that tired bag below the eye in some people. So like this patient who had a lower eyelid blepharoplasty to give her a more rested, more youthful appearance. Since the focus of the lower eyelid surgery tends to be that deeper fat and not so much superficial skin, this procedure we do typically do in the operating room. The way it works, we make an incision on the conjunctiva, the pink lining of the eyelid, and through that we get into those fat compartments that are causing the bag. Some of the fat we remove, but some of it we actually repurpose and create a tunnel into the upper cheek and tear trough area. That same area we put filler to improve this appearance. So at the same time we take fat away from where it's excessive, we're replacing it where it's volume deficient, because again, as the face ages, you lose volume, and the volume you have in your upper cheek drifts down. So The procedure really helps to blur that line of transition between the lower eyelid and cheek. When there is some redundant skin, we'll do a very small conservative skin resection, leaving the scar right along the eyelash line, so it hides very nicely right there. This patient had all of that done. She had the fatty bag removed, some of the fat transferred into the upper cheek and tear trough area, and a tiny pinch of skin removed along the lash line. This patient didn't have as much excess skin, so we didn't remove any. We just resurfaced it a little with an intermediate chemical peel. But we did remove and reposition that lower eyelid fat bag into the upper cheek, and you can see it gave her a really nice rejuvenated appearance of the lower eyelid where it blends right down into the cheek, um, like in a younger person. This shows her in the middle coming back for her suture removal about 5 days after surgery. So this little bolster stitch is there for the first 5 days, holding those stalks of fat that we pull from the eyelid compartment down into the upper cheek in place until they're sort of stuck in position. Um, for most people with this procedure, an acceptable appearance with a little makeup can be obtained within 2 weeks of surgery. All right, and then the last kind of component of periocular rejuvenation, rejuvenating around the eyes, is forehead and brow lifts. This used to require a big long scar from ear to ear back within the hair, creating all kinds of issues with hair loss in the scar, abnormalities in the way the hair parted. So most of us have really gone away from that technique. Now we're often using endoscopic cameras to perform the operation through just 3 small incisions that are hidden back in the hairline, not that long continuous one that leads to abnormal parts and stuff like that. That's a lot more noticeable. But we, through these incisions, pull back slightly and help to elevate the forehead and the droopy brow. And at the same time, that'll improve some of the forehead wrinkle formation that we are often treating with Botox. This patient had the eyebrow elevated just a few millimeters, along with that pinch of skin removed from the eyelid to achieve this more awake and more rested look. Another lady who had this procedure, just a subtle change, not overdoing it, avoiding that surprise look. I definitely do not like an overdone brow lift, but we did get that heavy brow pad and the eyelid skin up off of the lateral eyelashes. It just helps her look more awake and more rested. And then finally, this 31-year-old who just had the brow left alone because she always felt that she looked tired and angry, especially in photos because of her low brow. So she was just born this way. And just a few millimeters of lift for her really made a ton of improvement. Um, because of the equipment required, the endoscopic brow lifts are done at the surgery center. There are some techniques we can do in the office under local anesthesia. This patient had the forehead lift through an incision placed right along the hairline in the office, along with having that extra skin removed from the upper eyelids again. So in this technique, which we usually reserve for patients who either have a very long forehead because the forehead gets shortened with this operation, or who don't wear their hair pulled back, um, because the scar hides right along the hairline and could be visible with the hair pulled back. Um, this picture is taken just a few weeks after surgery, so the scar is still a bit pink. There's also another technique that we can do in the office where the lateral brow is elevated through a short incision just behind the hairline in the temporal region. This procedure it kind of mimics the effect of a very tight ponytail. So it's been nicknamed by some the ponytail lift. It's really just a axis incision over here in the lateral temple and a little suspension of the lateral brow. And then the last procedure I'm just going to briefly mention because it's becoming one of my favorites is the upper lip lift. As people age, the skin of the lips stretches, and so the distance between the base of the nose and the upper lip will lengthen, creating an aged appearance. In a simple office procedure, again, we can remove a small wedge of the skin in the shape of sort of a bullhorn or a mustache from the base of the nose. So here we see this patient about a month after the procedure in the upper right with the lip slightly shortened. The red part of the lip rolls out a little bit more, and the scar hides right at that natural boundary line between the base of the nose and the lip. So again, concealing the scar in natural anatomic junctional areas. Down below shows her a week out at the time of suture removal. Um, I'm going to show you a slide intra-op again, so there's going to be a little blood in the next one. Again, you can turn away if you're on the squeamish side, but this really demonstrates it coming together and what effect it has on the lip. Get this rolling here. So the upper lip length is shortened and the red part of the lip rolls outwards, um, giving the appearance of volumizing the lip because the red part is bigger, but without actually creating any additional volume to the lip. So to sum things up, every patient is different. Their anatomy is going to be different. The factors that are going to be most important to them are different. For some, it's downtime. That's the biggest deal. For some, it's really just kind of achieving the most optimal result and doing what it takes to get that job done. My job is really to educate people about the advantages and disadvantages of the different options, find out what's most important to them, and then come up with and execute a plan that we both think is going to lead to a happy patient in the end. I love the technical aspects of my job. I love being in the operating room, but what makes the deal the most satisfying is the happier, more self-confident patients that I get to see in the office after their procedures. And so with that, I'm going to give it back to Risa.
Yes, thank you so much, Dr. Forsberg. That was amazing. Wow. Did you guys all capture all of that? That was so much information. Before we get into the Q&A part, I just want to go over all the raffles with you guys. Of course, everyone that is here today is eligible for a complimentary cosmetic consultation with Dr. Forsberg. So that's amazing because, of course, everything is fully customized for each patient. So it would be lovely to know what Dr. Forsberg would recommend for you. So to take advantage of this, and I just want to make sure you guys all call in. You know, our phones just turned off because it's after hours, but you call in tomorrow morning to book. We need to get you booked before April 1st. After that, our raffles on the next slide here are free Botox for a year, which is an amazing raffle. And I'm sure you are all hoping you can win that. We are also going to give away one free syringe of a dermal filler, Juvederma Restylane. Third, we have a skincare basket to give away, which actually is at over $1,000 retail value. It's packed with goodies. And a fourth person will receive $500 off any cosmetic plastic surgery that they do with Dr. Forsberg. Again, these need to all be booked before, at least your first treatment booked before April 1st. And there are, you know, some little details that apply, but you're welcome to call the office and ask any questions if you have them. But better yet, before we get into the raffles, we have a bonus one you guys didn't even know about. So this is new as of now. We have an additional skincare basket that we've created and we're really excited to give it away. But to qualify, we need to go like Dr. Forsberg and follow him on Instagram. So you guys want to, let's all pull out our phones right now. Let's go to Instagram and type
And
in,
Facebook.
or Facebook, and type in Forsberg Plastic Surgery. I'll do this with you guys here. So this is what his profile should look like, at least on Instagram here. Whoops, kind of looks weird with my screen. So if you guys could all like him now, that would be great. And then you will be eligible to win also for this second raffle, this bonus raffle for the skincare basket. Also, don't forget to make a comment about the webinar in our today's post. So he has a post on the webinar. It's the one that's pinned to the top. So if you could just make a comment on this post so we can see you, that is how we will pick this skincare basket raffle. All right, everyone have this? I hope so. So now let's officially open for question and answer. Before we do this, I just want to show you guys all of Dr. Forsberg's contact information on this next slide. So if you guys want to take a screenshot of this, I will also go ahead and post it in to the chat here in a moment, because I'm going to take this down so you guys can see Dr. Forsberg big for the question and answer. So last chance to get your screenshot. All right. So with that in mind, this is the time now to start submitting any questions you might have into this Q&A feature. We already have a bunch, so let's get into it. All right, so first question, where are we here? All right, so what is the downtime and healing process after a facelift?
So it's all variable. We'll go over everything that's going to lead to optimal healing, like doing a lot of icing the first couple days, sleeping elevated the first week, taking it easy that first week. For most people, an acceptable amount of residual bruising and swelling happens at about 2 to 3 weeks after a facelift. So it is one of the longer downtime procedures, but that's about what you have to budget for on average.
Yeah, and that's how you get the great results.
Mhm.
All right. Can you explain how a deep facelift is different than the facelifts you've educated us about this evening?
So
A
I
deep
think there's a
plane
lot of
facelift.
misnomers on the internet right now about deep plane facelifts. I think like technically the textbooks in plastic surgery, a deep plane facelift is elevating the muscle um, at the same time, like in one plane as the skin, and all of it gets elevated as at once in one unit. What I do is elevate the skin separately from the muscle. The most important thing, there's been lots of studies looking at this over time in plastic surgery. Deep plane is for whatever reason been a buzzword lately and kind of made a comeback from that, but I'm not sure that everybody out there using that word is truly doing what we think of as plastic surgeons as a deep plane facelift. But the most important thing is to address the deep plane in some way or another, whether it's with the same skin envelope or separate from it. You need to resuspend those heavy soft tissues, the muscle, the fatty layer, in a separate layer from the skin. And so that's what we are doing that.
That is really helpful. All right. This is an interesting question. What is the most popular plastic surgery procedure that people are getting and asking for these days?
I think upper bleph is still the most popular actual surgery that we do, and it's just
Mm.
because it's such an easy sell. Like I said, the recovery is so easy for people. It's done in the office. You're in and out in an hour. Um, Universally, people love the result and they're happy with the result. There's very, very few complications ever with that surgery, so I would say it's upper blepharoplasty.
That's great. All right. What would you say for someone that has deep forehead lines and creases on the sides of their mouth? What is the best and longest lasting way to address them?
So options for that are going to be, I mean, you're going to want to do like preventative things after you do any kind of treatment anyway, right? So skincare and Botox to help soften the movement. Um, but your options would be injecting filler underneath the wrinkle to help kind of pop it out, or sanding down the wrinkle. And of those two options, I would say the sanding down with the laser treatment is going to last a lot longer than the temporary fillers or trying to put fat under there. Fat works great for revolumization, but not so great at like an individual wrinkle like that, like somebody I think is talking about. So I would say laser resurfacing is probably the better of the two.
Got
But
it.
again, that's why you come in for a consult. We look at exactly what's going on with you. We talk about our options. We talk through the pros and cons. Laser resurfacing, it's a week of downtime, but it's a rough week compared to a facelift. A lot of people who've had both will say the facelift was easier, even though it took longer to look a little better. Um, but yeah, that's why we talk through what the options look like and figure out what's right for you.
So, are there any age restrictions for a facelift or a neck lift? This person is in 62.
No, 62 is probably like the most common age that we're doing it. I think my oldest patient that I think I did a facelift revision on was 88. There are absolutely zero age restrictions, though. You do have to be healthy for surgery, so you have to get medical clearance. We have to make sure you're a safe candidate to take to the operating room. But age is really just a number. I've seen people in their 90s who look far better than some people I see in their 40s and 50s sometimes. So age is the number. It's what's going on behind that number that we care about.
Got it. All right. So, how about the other side of the age? What age could you consider? Would it be reasonable to consider a mini facelift?
I think for most people, it's probably in their 40s. There are some people in their 30s who, you know, will show up, and I'm shocked that they're in their 30s because for whatever reason the aging has happened prematurely. But for most people to start thinking about a mini, it usually happens in their 40s.
Do you offer Brazilian butt lifts?
They are not on the face, but yes, I do perform Brazilian butt lifts. I do all kinds of breast and body surgery. It is one of the more kind of hot button plastic surgery topics that we can certainly talk about the risks of in a consultation. But yes, I do them. I use the technique where we inject the fat superficially, not down in the deeper layer of the muscle to avoid all those scary complications. But there are still risks, and we talk about them.
So is liposuction a procedure that's done inside the office?
So small areas of liposuction I will do in the office if somebody just wants the back of their arms liposuctioned. Neck most commonly is done in the office if that's all they're getting done. Maybe a small front of the tummy only I'll do in the office. When we're, because we put numbing solution in the area that we're going to treat, so it's reasonable to not overdo the numbing solution and keep people comfortable with a small area of liposuction in the office. When it starts to be like 360 trunk or 360 thighs, things like that, then no, we go to the surgery center and make sure you're comfortable with some other methods as well.
All right. It seems some people are unclear about everything you offer. They're saying, do you offer rhinoplasty? Do you do surgery on the body? So let's just say it once again.
Yes, head to toe plastic surgery. There's very few things that I absolutely don't do. Hair grafts is one of them, but yeah, this topic was focused on facial rejuvenation, so that's where I dialed in to use our limited amount of time, but no surgery, body surgery, facial rejuvenation, and kind of breast and body, typical mommy makeover, tummy tucks, breast surgery is by far what I do most commonly, though.
Okay. So what type of procedures are normally included in a mommy makeover?
So, mommy makeover typically refers to the things that change the most during pregnancy. So, that would be breasts and body. So, for some people, a mommy makeover might mean a breast lift and some liposuction. For some people, it could mean a breast implant with lift and liposuction from head to toe. So, it just again depends on what's going on, but pregnancy, as all women who have been through it know, including my wife, who had her mommy makeover a few months ago. Um, that pregnancy does a number on things, and we're here to help clean it up.
Yes. Thank goodness. All right. So at what age can you start looking into laser resurfacing?
I mean, there's people in their teenagers that are getting laser resurfacing done for like acne scarring. Again, it just kind of it comes down to when you have wrinkles that are a reasonable candidate for a procedure of that magnitude. So I would say for most people, for wrinkles, the earliest would probably be in their 40s. Most people are in their 50s to 70s that would get a laser resurfacing.
Got it. All right. And tell us about an arm lift. Where is that done in the office or is that in the surgery center?
That's usually done in the surgery center. I have done like kind of a very minimalistic mini arm lift in the office before, but that's not the norm. The arm lift basically removes the bat wing um, through an incision placed along the inner aspect of the arm, usually from about the elbow to the armpit. But um, where the laxity is where the incision tends to go. So we kind of again there's no the thing I love about plastic surgery is that there's no like one answer for anything. There's not just this is how you do an arm lift. We look at the patient, we say, well, you need some liposuction around your whole arm, and we're probably going to have to extend the arm lift down into your forearm a little bit and maybe wrap it down into the chest and breast. Or it might just be a scar from the armpit to the elbow, which is kind of the most classic arm lift. But
Okay. All right, guys, we have a few more minutes. I'll get to as many of these questions as we can. But if I don't get to your question, I encourage you to ask it on Instagram to Dr. Forsberg, and maybe we
sure.
can do a live on social media to answer more. All right. Do you recommend a chin fillers or a chin implant, and how would you decide between the two?
Yeah, so you can use chin filler to augment the chin in a similar way as an implant. I don't think you can achieve quite as dramatic of a result. I think chin filler is good for somebody who needs really a minimal augmentation to kind of test the waters. Even for somebody who needs maybe a little bit bigger augmentation with the implant, um, to get a feel for what it's going to look like before they commit to the procedure to have the implant put in. But I've never had this happen, but if somebody gets their chin implant put in, they don't like the way it looks, you could easily pull it back out.
Hmm.
Um,
All right. And when you are getting a breast reduction, do you also lift breasts or is that a separate procedure and can it be done at the same time?
So a breast reduction kind of includes the two components of a breast lift already, which is to elevate the drooping nipple. So you want to get the nipple up to the kind of center of the new breast mound that we make. We're going to reshape and make the breast more perkier. So that's the component of a lift. In a true lift, we're usually trying to preserve all of the breast volume that we can. In a reduction, we're trying to, at the same time, we elevate the nipple and make the breast tighter, perkier, more attractive, reduce the volume of it.
Got it. Okay. So where are you available for consultations? And during a consultation, is it okay to talk about more than one thing, like a breast and a facelift, or do you need a separate consult for each surgery?
No, so it just kind of depends on, obviously we only have so much time. We can't go through every single plastic surgery procedure, but my patient coordinator, Stephanie, is great. You talk to her about kind of where your head's at, what you're interested in. Sometimes we do need to like focus on what the immediate attentions are and do those at the first consultation, but we often talk about faces and breasts at the same time in the same visit. So when you call in the office or email us, Stephanie will get in touch with you, kind of have a conversation about what you're thinking. And then we see patients in Scottsdale, kind of the Phoenix, Paradise Valley area. And then now shortly down at Camelback Dermatology in Arcadia.
Awesome. Okay, so there's so many more questions here, guys. I wish we could get to all of them, but I want to respect your time and let you all go back to your evening. So please make sure to follow Dr. Forsberg on Instagram or Facebook. I popped them in the chat. You can ask more questions there. And, if maybe we can come back and do another one of these or do an Instagram live or something.
Sure.
Otherwise, for this raffle, for all of you that have stayed on until now, I have captured all of your names and emails. And what we're going to do is I'm going to put you through a little randomizer on my computer, and we will contact the winners tomorrow. We want to respect everyone's privacy for HIPAA. So I don't want to start saying names live right now. But everyone that was here right now, we know what time you stayed until. So don't you worry, you're all in the raffle. And but overall, Dr. Forsberg, this was very helpful. We really appreciate your time. I know you've already had a busy day in the clinic today. And for everyone that attended, we really appreciate you guys coming. I know you all had busy days too. And I hope you all take advantage of the complimentary consultation. Dr. Forsberg can certainly answer all the rest of these questions one-on-one in a consultation. And there's a lot of questions about pricing as well. And everything is just so customized based on what you need. So I really encourage you to schedule a consultation, and you can always talk to Stephanie as coordinator as well. So we will be sending out this recording soon. If you win the raffle, we will notify you tomorrow. And if you are, are okay with it, we will share on social media for everyone else to see. But otherwise, Dr. Forsberg, thank you so much again. We really appreciate it.
Awesome. Thanks for doing this. This was great.
Yes. All right, everyone. Have a great evening, and we hope to see you back at the Center for Dermatology and Plastic Surgery and Camelback Derm soon.